Hello, my name is David Duan, and my proposed research is to research the use of sustained-release latanoprost implants to increase the expression of matrix metanoproteinase for the treatment of glaucoma. Don't worry, I'll explain all this later. So what glaucoma is an eye disease where the trabecular meshwork is blocked. As seen in the image in the bottom right, the trabecular meshwork, also known as the TM, is located around the pupil. The trabecular meshwork is made of a spongy-like collagen fibers, which is very porous and allows liquid to pass through. This liquid is called aqueous humor and is used to nourish the eye as well as the cells inside the eye to grow. So in patients with glaucoma, the TM is often blocked, which prevents the liquid from draining out, causing increased pressure to push against the optic nerve, which the optic nerve is responsible for sending signals from the eye to the brain. And glaucoma is the leading cause of blindness in the world right now. So patients often develop loss of peripheral vision, as seen in the middle image here, loss of peripheral vision basically means that you can only see through the center of your field of view and not the rest, as well as redness in the eye and halos around light sources. There's currently many medications to either reduce the production of liquids or increase the outflow, or a combination of both. All of these helps to reduce the intraocular pressure, IOP, of the eye. So the drug that I'll be researching is called prostaglandin analogs, such as latanoprost or bimatoprost. These work by increasing the expression of an enzyme called matrix metanoproteinase, also known as MMP. So what MMP does is it helps rebuild and remodel the drainocytes inside of the eye. It makes them more permeable to liquids. MMP is not unique to the eye. It's also located in other parts of the body, such as blood vessels or most notably bone. So when you break your bone, MMP helps to remove any old bone and then add on and grow new, stronger bones. This is similar to what it does in the eye by removing the old TM and replacing it with more effective and porous trabecular meshwork. So current method of delivery of daily eye drops is very inefficient because of the cost, as these bottles often cost $30 per bottle, and they only last around 4 to 5 weeks. So this is not very cost efficient in the long term, especially for low income families. And it's also difficult to apply since patients are often elderly patients above the age of 60, and they have very shaky hands. So they will not always apply the drop on the proper location every single time. This in turn causes side effects, such as conjunctival hyperemia, which is just conjunctivitis of the redness of the eye because of the increased blood vessels, as well as periorbitopathy, which is decreased fat inside the eyelids, causing a sunken eye look. But the most important of why this is ineffective is because of forgetfulness, as multiple eye drops per day is often hard on elderly patients, and missing even one dose can revert eye pressure back to its original dangerous state. So as a result, patients only took the required dosage around 37% of the time. So past research has indicated that a viable method to solve this is sustained release capsules of bimatoprost when inserted intracamerally. What intracamerally means is the outer chamber of the eye. If we go back to the previous slide, the outer chamber is just the left side. Anything from the cornea, which is the outer layer, onto the lens, which is this thing that I'm circling right here. So bimatoprost has been shown to be effective in SR, which is basically just a capsule that they insert in your eye, and it slowly diffuses and releases medications over a span of 6 months. However, latanoprost, which is a similar drug, which is more tolerable in humans, has not been studied yet. So the goal is to determine the most effective dosage for different prostaglandin analogs drugs by changes by researching the use of latanoprost SR to lower eye pressure. And the hypothesis is that if 6 micrograms of SR latanoprost is injected intracamerally, then patients will recover with normal levels of eye pressure for the longest time. So for the materials and methods, basically the baseline IOP, which is the intraocular pressure, is measured in 100 dogs using a rebound tonometer, which is a device used to push a small plastic tip against the cornea and to measure the resistance that it faces. The more resistant it faces, the equals the more pressure inside the eye. Then they would use laser coagulation, as seen in the top right, to artificially clog up and block the TM, thus increasing IOP to around 30 millimeters per liter mercury. And the new IOP is measured, obviously. And these dogs are split into 5 groups, either receiving 6 micrograms, 10, 15, or 20 micrograms, or no drugs at all of Latanoprost SR. So these capsules are inserted using a 28 gauge single-use applicator, as seen in image B right here, and these are injected intracamerally, obviously. These implants are like cylindrical and around 200 microns as its radius, and with a length of 1.1 millimeters. And basically how this is injected is you just stab this needle inside your eye, and then because of the small tip, as you pull it out, the cornea will heal itself and prevent any pressure or blood loss or any of that. So then researchers would use a slit lamp, which is located here, the image on the bottom right, to validate the implant is in the right location. And a slit lamp is basically just a microscope that focuses a bright light on a thin beam to see inside the eye. And the finished product should look like this on the image on the right of the proper location of the sustained release capsule. And then the pressure is measured every week to see whether it has returned to its normal levels, which is between 12 and 22, and then the data is recorded. So anticipated results is that Latanoprost SR and Bimatoprost SR should be nearly identical, with 6 micrograms being the most effective dosage. And this graph in the bottom left is the trial from the Bimatoprost study, the Bimatoprost SR studies, and you can see that 70% of participants are able to independently remain on SR treatment options at 6 months. This just means that they didn't need any other medications and could just remain on the SR drug after 6 months. And from this graph, you can also see that the higher dosages are actually bad because they increase the expression of MMP too much, and which results in excessive removal of the trabecular meshwork, causing more time to grow back and be effective once again. So on this slide, you can see how there'd be less side effects because of the reduced exposure and contact to different parts of the eye, such as the bulbar conjunctiva, which is the white portion of the eye, or the preorbital fat, or eyelid margins, meaning because of the reduced contact, we reduced the infections. And yeah, so conclusion is either it's proven that 6 micrograms is the most effective dosage. In that case, the application is that this demonstrates that most prostaglandin drug functions the same in sustained release form, and this can be used as a better alternative to eye drops, obviously. Limitations being that this has only been tested on dogs and not humans, as well as the change in IOP being an artificial one using laser coagulation. For the research being that we should test this on other prostaglandin analogs, such as Latanoprost, which is another drug. If the hypothesis is disproven that another dosage, either 10, 15, 20 micrograms is most effective, this demonstrates that all prostaglandin drugs are different as dosages should differ, limitations are the same. And further research is to examine why the dosage is different. Is because of the chemical composition of Latanoprost compared to Bimatoprost, and to see whether there are any long-term adverse effects of large doses of sustained release capsules. So I'd like to thank Mr. Prendergast, my pod classmates Spencer and Thomas, as well as my amazing senior mentor Max Strager. Thank you.